therapy today, specifically Spravato, and we're going straight to the source for this one, a certified Spravato treatment center.
Yeah, and what's interesting right off the bat, we're not talking about your typical, like, first-line antidepressant here. This is different.
Totally. It's a nasal spray for depression, but
Mhm.
we're talking treatment-resistant depression. So I think, you've tried at least 2 other antidepressants and nothing, no dice.
Right, they haven't worked, and that's where Spravato might come in. But even then, it's super important to
Absolutely.
talk to, of course, a healthcare provider. They'll look at your, medical history, what medications you're on, your overall health, the whole picture.
Makes sense. Now, this isn't something you just pick up at the pharmacy, right? It's got to be at a certified treatment center, right?
Certified treatment center.
Under supervision and all that.
Exactly. And that's because, well, there are potential risks, right? Like sedation, dissociation, things we'll get into a bit later. And because of that, there's this thing, it's called the REMS program.
Okay, yeah, the REMS program. What is that in plain English? Like, what does it mean for someone listening who might be considering Spravato?
Basically, it means both you and the treatment center, you're both part of this program, and it's all about making sure Spravato is used safely, appropriately. So there's monitoring, specific protocols, all that.
When I hear about these strict safety protocols, it really hits home how serious treatment-resistant depression is. We're talking about people who have often tried everything else, and this is like a whole other avenue. But it's not, it's not something taken lightly.
Exactly. And it's not just for long-term treatment-resistant depression either. Spravato can also be used for adults with major depressive disorder, but they're experiencing, acute suicidal thoughts or behavior, that kind of thing.
That's huge. When you talk about those situations, those acute situations, it really highlights how with mental health, it's not always, a gradual thing. Sometimes it's immediate.
Right, exactly. And that's why having, options, having this range of treatments is so important, because what works for one person might not work for another.
Yeah.
Especially with something as complex as depression.
Totally. Okay, so someone's considering Spravato. What should they expect even before that first treatment?
Well, like anything else, preparation is key. That first visit, it's really an assessment. So your healthcare provider will, go over your medical history, especially anything related to, depression, obviously. They'll ask about substance use, and we're talking everything: prescription drugs, illicit drugs, alcohol.
The whole 9 yards.
Exactly. And any history of like blood vessel conditions or brain bleeds, things like that. It's about, like I said, getting the full picture.
So honesty is the best policy here. Right?
Absolutely. This isn't about judgment. It's about your health, making sure Spravato is actually a good fit for you.
It's about personalized medicine.
Exactly. You got it. Think of it like creating a roadmap, to help us navigate your needs and make sure Spravato, if it's right for you, aligns with, your whole journey.
Okay, that makes sense. Now, let's say someone's been approved. They're going to start Spravato treatment. What does that actually look like? What's the day of treatment like?
Okay, so logistics first. No driving after treatment.
Right.
Because of those, sedation and dissociative effects we talked about.
Yeah, you don't want to be behind the wheel after this.
Exactly. So you've got your ride. You're at the treatment center. What's next? Well, you will be self-administering this Spravato. It's a nasal spray. But a healthcare provider will be right there with you, like guiding you through it.
They're not just going to hand you the bottle and say, see ya.
Not at all. It's very controlled. And a couple of pre-treatment things. You'll fast for about 2 hours beforehand, no liquids for at least 30 minutes before. And if you use any nasal corticosteroids or decongestants.
Which, a lot of people do.
Right. Talk to your doctor about, the timing of those on treatment days.
It's all in the details.
It is.
Okay, so you've got Spravato, now what?
Now it's monitoring time. You'll hang out at the treatment center for at least 2 hours after you take Spravato.
And what's the purpose of that? What are they monitoring?
It's all about safety, right? Managing any side effects. Healthcare professionals are right there, making sure you're feeling okay, addressing any, immediate reactions.
So bring a book, some music, whatever chills you out, because you're going to be there for a bit.
Exactly. Now, speaking of side effects, probably the most common one during and right after taking Spravato is dissociation.
Okay, that's one that always, I don't know, it's a weird one to wrap your head around. For our listeners, can you sort of paint a picture of what that actually feels like?
Sure. So imagine feeling disconnected, but from yourself. Your thoughts, your feelings, even your surroundings. It's like the world around you is, I don't know, distorted, unreal, kind of dreamlike.
Whoa. That's a lot to process. Imagine that, feeling like you're disconnected from yourself, your surroundings, everything you know. How do treatment centers help people through that?
It's definitely, yeah, it can be intense. It's one of those things, though, that knowledge is power,
Yeah.
right? So before you even have your first treatment, the healthcare providers, they'll really explain it, so you know what to expect.
Mm.
And during that monitoring time, they're checking in, making sure you're okay, offering reassurance. The important thing is it's temporary.
Yeah.
It'll pass as the medication wears off.
Okay. Oh, good to know. Good to know. So we've got dissociation. What other side effects might someone have in those first couple hours?
Um, let's see, you might feel a little dizzy, maybe nauseous, some sedation, maybe a spinning sensation like vertigo, changes in your sense of touch even, or some anxiety. Those are all pretty typical, and they usually go away, like I said, within that 2-hour monitoring window.
Okay, so a whole, it runs the gamut, but it sounds like, manageable with the right support. What about effects, though? Anything to be aware of there?
Yeah, so some people mention like a lack of energy that lingers, maybe increased blood pressure. Some people experience vomiting or almost like a drunk feeling. And again, everyone's different. That's why that monitoring after each treatment is important. Helps adjust based on how you're doing.
You mentioned earlier, and I wanted to circle back about, that increased risk of suicidal thoughts or behavior with Spravato, and that's heavy stuff.
It is, and it's something we have to talk about, openly.
Yeah.
Because as helpful as Spravato can be, it's serious.
Right.
It has risks.
And that's why that communication with your care team is so important. Being honest about any changes in mood, your thoughts, but also just knowing that we're in this together, right? Like we're here to talk, to listen, to support. So yeah, if you're considering this, if you're listening, thinking about Spravato, be vigilant. Pay attention to any shifts in your mood, your thoughts, behaviors, anything. And if you notice anything concerning, especially any thoughts of suicide or self-harm, you've got to reach out, call your healthcare provider right away. Don't wait.
Could not agree more. And remember, you're not alone in this, Talk to someone, lean on your support system, your family, your friends, a therapist, whoever it is you trust. Talking about it, that's huge. Okay, so we've talked about the risks, but I don't want to lose sight of, the fact that for a lot of people, this is a turning point, right? Spravato can be what works when nothing else has for severe treatment-resistant depression.
Absolutely. And that's what it comes down to, weighing those potential benefits against the risks. And again, that's the conversation you have with your healthcare provider. They're your guide. They can help you make sense of it all.
So let's say someone is going to do Spravato treatment. What's that look like? How often are we talking?
So usually it starts off pretty frequent, twice a week for the first month, just to, get things going. And then month 2, it usually goes to once a week. And after those first 2 months, that's when you and your provider, you really work together to figure out,
so it's
okay,
not
what's the plan
like one
moving
size fits
forward?
all.
Not at all. It's all about you. What works best for you as an individual? So maybe it means adjusting the frequency of treatments. Maybe it means bringing in other treatment options along with Spravato. Think of it like you and your care team. You're a team.
Yeah, finding the
you're
right
working
combination.
together to fine-tune
Because
everything.
it's not just about medication, right?
Exactly.
It's about giving you, the patient, the tools to actually reclaim your life.
100%. And honestly, a lot of times,
Yeah.
Spravato is used alongside other things. So,
Right. Looking at the whole picture. Well, we have covered a lot today. The initial consultation, potential side effects, monitoring that open communication. It's a lot, right? And it makes you realize, Spravato, it's promising, but it's involved. And I think that kind of brings us to the so what of it all, what does it tell us?
oh, I'm so glad you brought that up. Because, yeah, the fact that Spravato even exists, right? That there is this treatment with all its, requirements, the potential risks, the monitoring, it says something about, severe treatment-resistant depression, doesn't it? About how significantly it can impact people's lives, and I think their resilience in trying to find relief.
It really does. It makes you think about how strong people have to be when they're dealing with something like this.
For sure. I mean, just think about it, right? People are willing to go through all these hoops, the screening, the treatments, the side effects, the monitoring, everything, just for the chance to, feel better. To not feel that way anymore. It's kind of amazing.
Yeah. It makes you realize how much hope people have. Another thing that I think is pretty wild is just that, we're even having this conversation, the fact that a treatment like this is out there means that things are changing, right? For mental health care, people are trying new things, finding new ways to help people who haven't had success with the usual stuff.
100%. And you know what that tells me? We've got to keep going. More research, more understanding about these conditions. Like, we were saying, treatment-resistant depression, we've come a long way, but there's always more to learn,
Yeah, absolutely. Well, on that note, I think we've really gone deep today, haven't we, on esketamine therapy? We talked about Spravato specifically, but also like those bigger questions about treatment-resistant depression in general. And really, I think what we keep coming back to, just how much people want to feel better, to get their lives back.
It's been a journey. And hopefully anyone listening, they're walking away feeling like, okay, I get it. I understand this a little better. And, maybe they feel empowered to like advocate for themselves, for their own mental health, or to support someone they love who might be going
That's
through
what
this.
it's all about. And knowledge is power, right? The more we know, the better we can handle these things.
Couldn't have said it better myself. Keep asking questions, stay curious, keep that conversation about mental health going. That's what matters.
And you're not alone. That's the other thing. Big thanks to you for coming on and sharing your expertise with us today.
Happy to be here.
And to all our deep divers out there, thanks for, coming on this journey with us. Until next time, stay curious.
Thank you so much for joining me today. If you found this video helpful, please hit the like button and share it with your loved ones. Subscribe for more content on mental health awareness. Remember, there's no health without mental health. Until next time, take care of yourself and each other.